CNA Practice Test Questions and Answers. A patient on a bowel regimen has not had a bowel movement in 4 days. What is your next step? A. Report this to the nurse in charge. B. Give the patient orange juice with Miralax. C. Encourage the patient to drink more water. D. Do nothing, this is normal. Correct answer. Report this to the nurse in charge. Patients on a bowel regimen require scheduled medications to prevent constipation. A lack of bowel movement for 4 days could indicate a bowel obstruction. CNAs must report this to the nurse, as administering medication is outside their scope of practice. When assisting a resident who uses a cane for ambulation, how should you position yourself? A. Stand on the same side as the cane. B. Stand on the patient's weaker side. C. Stand behind the patient. D. Walk backward in front of the patient. Correct answer. B. Stand on the patient's weaker side. The cane is held on the patient's stronger side. Standing on the weaker side allows the CNA to provide support if the patient loses balance. Proper perineal care for females involves wiping front to back to prevent bacterial spread from the rectum to the A. Uvula. B. Urinary meatus. C. Cervix. D. Uterus. Correct answer. B. Urinary meatus. Wiping front to back prevents fecal bacteria from entering the urinary tract, reducing the risk of UTIs. A diabetic patient finishes only 25% of their meal. What should you do? A. Report this to the nurse. B. Assume the patient isn't hungry. C. Wait until dinner. D. Document it in the chart. Correct answer. Report this to the nurse. Diabetic patients may receive insulin based on meal intake. Inadequate eating can lead to hypoglycemia, requiring immediate intervention. A patient on a clear liquid diet for a colonoscopy should receive A. Milk, tea, and soda. B. Water, coffee, and milk. C. Jello, Sprite, and broth. D. Soup, coffee, and tea. Correct answer. C. Jello, Sprite, and broth. Clear liquids are transparent at room temperature, e.g., broth, gelatin, clear juices. Milk and soup are not allowed. An Alzheimer's patient refuses dinner. How should you respond? A. Pressure them to eat. B. Threaten to involve the doctor. C. Explain the health risks. D. Respect their choice and inform the nurse. Correct answer. D. Respect their choice and inform the nurse. Forcing food can cause distress. Report the refusal to assess underlying causes, e.g., dislike of food, swallowing issues. If a patient starts to fall while using a gait belt, what should you do? A. Lower them gently using your legs. B. Lean forward to catch them. C. Yell for help. D. Let them fall. Correct answer. Lower them gently using your legs. Use proper body mechanics to protect both the patient and yourself. Avoid bending at the waist to prevent back injury. A dysphagia patient's diet should include A. Pureed foods. B. Clear liquids. C. Mechanical soft foods. D. Regular foods. Correct answer. C. Mechanical soft foods. Mechanical soft diets are easier to swallow and reduce choking risk. Thickened liquids may also be required. How to assist a post-stroke patient with left side weakness in dressing. A. Stand on their left, weaker, side. B. Have them sit while you dress them. C. Stand on their right, stronger, side. D. Have them lie down. Correct answer. Stand on their left, weaker, side. Supporting the weaker side ensures stability and safety during dressing. A patient takes too long to eat, missing physical therapy. What should you do? A. Advocate for their right to eat slowly. B. Schedule lunch earlier. C. Report the therapist. D. Rush the patient. Correct answer. B. Schedule lunch earlier. Adjusting meal times ensures the patient receives full therapy sessions, which are critical for recovery. A patient showers once weekly. What should you consider? A. Enforce facility shower schedules. B. Cultural bathing preferences. C. Inform the family. D. Assume depression. Correct answer. B. Cultural bathing preferences. Cultural norms may influence bathing frequency. Respect patient autonomy and discuss preferences respectfully. A dehydrated patient is at risk for all except A. Mouth sores. B. Bad breath. C. Skin ulcers. D. Swollen gums. Correct answer. D. Swollen gums. Dehydration causes dry mouth, skin breakdown, and oral sores. Swollen gums are typically due to dental issues. Signs of pain in an elderly patient exclude A. Insomnia. B. Social withdrawal. C. Social participation. D. Agitation. Correct answer. C. Social participation. Pain often leads to withdrawal from activities. Social engagement is not a pain indicator. ADL care priorities exclude A. CNA's comfort. B. Patient comfort. C. Safety. D. Dignity. Correct answer. A. CNA's comfort. Patient comfort, safety, and dignity are priorities. The CNA's comfort is secondary. How to assist a slow but independent patient with dressing. A. Rush them. B. Stay nearby as standby. C. Ask them to hurry. D. Delegate to another shift. Correct answer. B. Stay nearby as standby. Elderly patients may need more time. Provide patience and support without pressure. A soft toothbrush is used for A. Denture cleaning. B. Sore gums. C. Unconscious patients. D. Dry mouth. Correct answer. C. Unconscious patients. Unconscious patients require gentle oral care in a lateral position to prevent aspiration. Avoid applying lotion to A. Back. B. Knees. C. Chest. D. Toes. Correct answer. D. Toes. Moisture between toes can lead to fungal/bacterial infections. Keep toes dry. Correct shaving technique includes A. Shaving upward on the neck. B. Upward strokes on the chin. C. Long strokes. D. Rinsing every 2 to 3 strokes. Correct answer. Shaving upward on the neck. Shave in the direction of hair growth with short strokes. Rinse the blade frequently. A Hoyer lift is used to transfer a patient from A. Bedside commode to chair. B. Bed to bathtub. C. Wheelchair to shower. D. Bed to stationary chair. Correct answer, D. Bed to stationary chair. Hoyer lifts safely transfer immobile patients between bed and chair. Two-person assistance is required. Hair care for residents should consider A. Age. B. Race and culture. C. Hygiene. D. Transfer status. Correct answer, B. Race and culture. Hair care practices vary culturally. Always respect individual preferences and needs.